Hello, everybody in podcast land. I'm Dr. Ted Thachenkary, and this is MD Roundtable, a podcast about collaborating and learning from other healthcare professionals from all over the globe. We are all so much more connected due to technology. We have so much to learn from each other. Thanks for joining us today at MD Roundtable. This is a very special episode as we are featuring Dr. Oleksandr Babliak, who is the Chief of Cardiac Surgery at Dobrobut Medical Center in Kyiv, Ukraine. Welcome to MD Roundtable, Dr. Babliak.
Yes, nice to hear you and nice to join.
Thank you so much, Doc. First of all, I know this is very difficult for you, and especially with the Russian invasion. And I know just today you had messaged me that you're going to be staying at the hospital to do this interview just because there's been a lot of power outages going across the country because of the Russian attack. So I really appreciate you being here and taking the time.
Yeah, so now at least everybody in the world knows where Ukraine is, and I hope that we will do a good interview.
Yes, thank you, Doc. Dr. Babliak, first off, why don't you tell us what's life like right now in Kyiv, Ukraine?
Kyiv, it is not easy time, so definitely, because Russia attacking the civilian people and the infrastructure. So they do this on purpose, and just before the winter, it is very cold. So now it's like plus 5 degrees in Kyiv, and we still don't have any sources in the large buildings of heat. Because of several stations, several energy stations have been destroyed by the rockets. So that's the problem, not only for doctors and patients, but only for older people, for kids, because temperature in the flats go down.
Yeah, that's very heartbreaking, Dr. Babliak. Do you see any signs of normalcy, life going back to normalcy in Kyiv?
I think we will have the next few weeks very hard, but eventually we will definitely defeat these attempts of destroying the country, because Russia is out of the rockets, out of the bombs. Now they are using Iranian bombs and rockets, but I think all the world should understand that this war will stop soon. And this is probably the hardest time now, not only for our army, which is fighting very nice, and we are very proud for our army, and they are very close to the victory. And but it is also very difficult times for the civilian people, and for especially for the kids and for older ones.
Yeah, I can't imagine what you and your family have been going through, Doc. Did you grow up in Kyiv, Dr. Babliak?
No, I was born to the west, city Lviv. It is in western Ukraine, but at the age of 35, so it was 17 years ago, I moved because of the cardiac surgery. I moved to Kyiv. So, but I was born in Ukraine, went to school in Ukraine, entered the university, and achieved my specialization in the surgery and in the cardiac surgery also in Ukraine.
I see. So your medical training was in Ukraine, is that correct?
Yes, after I received the complete training in the cardiac surgery in Ukraine, I also received the additional training in Sydney for more than 2 years. It was in 1999, 2001. Some Royal North Shore Hospital in New South Wales.
In Australia, correct?
Yes,
Great.
that's right.
Dr. Babliak, what made you interested in going into medicine? Did you know as a child that you wanted to be a doctor? What inspired you?
It was quite easy decision for me because my father was the professor of surgery.
I see.
And I was definitely inspired by this. But when I went into the medicine, I understand that the cardiac surgery is a very nice specialty because you can see that some more than 99% of patients can be cured with from the problems. And this was also very inspired for me, and I liked cardiac surgery from the beginning because it was like a nice balance of thinking, of a decision, some making in the surgery, and also like a balance with the surgical creativities that you should do during surgery.
Okay, great. So for the listeners, Dr. Babliak, in the U.S., I guess what you did in Australia would be like a cardiothoracic fellowship.
Yes.
Is that what you did in Australia, in Sydney? Would that be equivalent to a fellowship in cardiothoracic surgery?
Yes. So Australia system is a little bit different from the European system. They have the registrarship, which is equivalent to the residency and to the fellowship in the U.S. Yes. So I did 2 years of the registrarship in the cardiothoracic surgery, and we have the international team. We had Indian people from the Middle East in the team because they were all joining the program as overseas fellows.
That's outstanding. Yeah. What was it like to be a young surgeon going from Ukraine and living in Sydney? What was that transition like for you?
Transition was very interesting, very special, because you can imagine that Ukraine was at that time, it was a lot of the Soviet system. So it was very abrupt change from the mentality of the Soviet medical system to Australian medical system. Of course, they are very different, especially in the terms of the responsibility. In Ukraine, I was already a doctor with responsibilities, and in our Australia, I was the fellow under the responsibility of the consultant. So it took me a little while to understand this, and after this, I was getting a lot of information in the medical field that helped me to treat the patient in the right way. Yes, it was very nice time, and what is interesting, the most important questions that I was pushed to answer every time is like why we do this and why we do this. So every prescription had its own reason, and it was at that time it was very different from the Soviet Union.
Yeah, it must have been very different for you. So That's fantastic. Thanks for sharing that. So, Dr. Babliak specializes in what's called minimally invasive cardiac surgery. Can you tell us about the minimally invasive techniques you use?
Yeah, so if we can speak some of what is it minimally invasive cardiac surgery, it's we can unite all these techniques with two words, like it's a sternum sparing surgery.
Mm-hmm.
So all the techniques that we use in the minimally invasive surgery, they don't include the cut in the sternum, which means that we don't touch the bone, and we do all kind of cardiac surgical procedure through the separate incision between the ribs, and often these incision muscle sparing, so it is kind of cardiac surgery with the minimal trauma for the patient, which of course increase the recovery of the patient and the satisfaction. It is like less.
Yeah, that's fantastic, Dr. Babliak. Traditionally, like you were explaining, if somebody needed, let's say, a bypass surgery, they would have to undergo what's called a sternotomy. But with your minimal techniques, you can essentially bypass that, correct?
Yes. So, and you can avoid cutting a sternum in almost every patient. So, in my experience, 98% of patients could be operated with this minimally invasive techniques.
That's brilliant. Yeah. I mean, that essentially means, decreased length of stay, like you said, decreased risk for the patient. I would think decreased complications, etc.
Oh, yeah. Also, I would add that we can exclude the complications because we don't touch the bone, so we don't have such a very serious complication as sternum osteomyelitis.
Mm-hmm.
So we don't see them, and this is also good.
That's brilliant, Dr. Babliak. Now, as far as the minimally invasive procedures, are there specific ones that you specialize in? For example, valve replacements, etc.
Yes, we have been doing the valve replacement with the valve repair with a minimally invasive approach, maybe already for 10 years. But what we are specialized in now that we can do all the coronary artery bypass grafting with a minimally invasive approach. And this technique is very new for the world because to do the mitral valve repair through the right mini thoracotomy or to do the aortic valve has been already used in the world for the last 20-25 years.
Mm-hmm.
But to do multi-vessel CABG through the left mini thoracotomy was tried in the late 90s, but did not have a huge success and wide adoptions of this technique because of many complications,
Mm-hmm.
which were joined with the peripheral cardiopulmonary bypass, which have been improved since a lot since those sometimes. And now we can use this technique with the same results or some better that we can do the conventional CABG through the sternotomy. So we are pushing the limits of the minimally invasive surgery first of all in the field of the multi-vessel coronary artery bypass graft.
That's extraordinary. What is the most challenging procedure for you with minimally invasive technique?
Every time you do a new procedure that have not been done by you, that you have not been seen everywhere, is the most challenge. And for example, the last procedure that we discovered that now we can do routinely is to do the combined sort of procedures, like we can do a cabbage and we can do mitral valve repair through the small left anterior thoracotomy, which is always like a challenge. When you do something, you don't know if it will be easy or not, but you discuss the options with the patients, and for example, you will always have sometimes a patient who will definitely benefit from this minimally invasive approach because of the comorbidities, and you discuss the options and you go. So always a new procedure, when you do it the first time, it is always a challenge, and it is very difficult time, yes.
I see. Dr. Babliak, do you also do pediatric cardiac surgery or just focus on adults?
Yes, I do pediatrics. I have spent 11 years in the Ukrainian Children Cardiac Center, and our team in this center did over the 1,500 cases for congenital heart disease every year.
Wow.
So in that center, we got the experience in the most some rarer and the most complicated some neonatal cases and so on. So having this experience with the neonatal cardiac surgery and with the minimal invasive adult cardiac surgery, I was thinking that we also should do something better for the kids, and to try to do more sternum spare surgery in the kids. So we have been influenced a lot by Professor Schreiber and from Germany, and Professor Wen Han from New York. So we expanded their techniques as well, and now we can do all the VSDs, AVSDs, and even the tetralogy of Fallot through the small incision under the right arm. It's called axillary mini thoracotomy.
Wow, that is amazing. It sounds like you're really trying to be pioneering this, especially in kids, where I can really see a benefit, for children to have minimal incisions and try to avoid the sternotomy. So yeah, thank you. That's great.
Yeah, it's not only for the recovery, which is absolutely quicker for these kids, but we also should think that this is a good thing to help them from the psychological point of view. So nobody will see the scar when they will become like 16 years old.
Yes.
So this is very good. Agree.
Yes. How long have you been working in this field, Dr. Babliak?
I was qualified in the cardiac surgery in 97, so it's 25 now.
Okay.
25 years.
And in your field, what's been the biggest surprise you've had in the last few years in your field?
Surprise is probably how easy the procedure could become when when you do it several times. So when you do something for the first time, it seems to be very difficult. After you do it 2 times or 3 times, 10 times, it becomes some routine. So this is probably the most surprising thing for me.
Okay. How do you continue to learn and stay up to date in this field?
The communication with my colleagues, which we always do, it is very important, and also because I see the need for the minimal invasive surgery in the field. So I see the need not only for the surgical techniques, but also for the instruments. So we are in the process of the designing some instruments that will help cardiac surgeons to do this kind of surgery with the new instruments. So new instruments should be developed, and this is also like a point of the communication with the industry and with other people.
Great. And what was your experience like in Ukraine as a cardiothoracic surgeon during COVID?
Of course, during the COVID, elective surgery went very down, and we were pushed to change a lot of our protocols. But we were almost prepared because we already did the CT scan for every patient, because most of our surgery was at that time already minimally invasive. So we were already, and we were very easy to adopt some new safety features, which include CT scan and some testing came soon after the onset. So surgery went down by the numbers, but not too much on our usual situation in the hospital. So yes, we started to do like some meetings much less, and this also changed a little bit our daily practice. Yes.
Yeah, just like everywhere in the world, right?
Yeah.
And during the war, Dr. Babliak, I assume you're still able to do a lot of elective cases. Is that correct? Or is it more of the emergent cases that you're doing?
We do like less than now, with the things are getting a little bit some worse with energy. So now we are doing a little bit less than 50% of our activity, but our cardiac unit is open, so we continue to do our job. What we can do, we should do the best we can, and let's see what will happen.
Yes. What are some of your interests outside the operating room? For example, how do you like to decompress, if you do?
So now it is time. It is very hard to decompress because you always in this war condition.
Yes.
But we will relax after the victory, and we hope that the victory will come very soon. I think 2-3 months, and we will be much more closer to keep our people in a safe situation, and all the world in the safe situation. Because the question is, for us, is to be or not to be, to survive or not. But also we at the same time, this is a question for all the world, to be in a more safe condition that it was like even 6 months before. So we I must say that we are fighting not only for our safety and for the survival, but for the safety of all the world. And we are very happy that most of the world support us with what they can.
Yes, I agree. I hope that you guys have victory soon. And I hope you and your family stay safe, Dr. Babliak. And I really want to thank you for taking the time to do this interview and just keep doing what you do. You seem like a very humble surgeon, and I hope that you can continue to make great strides in the minimally invasive cardiothoracic techniques that you do.
Thank you very much. And yes, we will see soon. We will see soon each other in the safer place and not online, but offline.
Yes, yeah. Definitely.
Thank you.
Thank you, Dr. Babliak. Take care.
Bye.
Bye. Folks, if you enjoyed that episode, don't forget to leave a review of the MD Roundtable podcast on Apple iTunes, and please don't forget to subscribe. Stay tuned for our next podcast coming to you soon. Thanks for joining me again, and have a great day.